Hi, everyone. Welcome back to the Lights Too Bright pod. Today, I have managed to persuade one of my friends from across the pond to come and join me and have a conversation. I've known today's guest for, it's coming up to 20 years now. Time seems to have flown. Whilst I was out in the US doing residency, he is one of the most laid back people I think I probably know within the industry. Uh you've heard the saying, he's so laid back, he's pretty much lying down. That is today's guest persona. One of the smartest people I know, and really, really glad that he's taken the time to be on with me today. So, Anu, Laul, welcome. How are you, sir?
Hey, appreciate it. And funny you should say that because I'm going to mention in a moment that I do teach at a university, a college of optometry. And part of my role is being an attending in the clinic, and we do get student feedback. And so I got student feedback yesterday, and I usually have about 8 students per quarter, and they have an optional section on comments. And there was only one comment, and it said "chill doc." So that was the only comment that I got for this past quarter. So yeah, funny you should mention that.
I don't think I've ever seen you flustered. I don't think I've ever seen you get angry, like, or annoyed. Like, and you know me,
Right.
like, you've seen me vent, like, and I was like, no, just chill.
That's it,
So
dude.
maybe it's a Canadian thing because I don't think I ever saw Nate get
Yes.
stressed or kind of like pushed out or at all. So, but you are the chill doctor. Maybe that's what I'll call the episode.
Yeah, that's it. Awesome, dude.
So, which university, Anu, for
Yeah.
the audience?
So I'm an associate clinical professor at the State University of New York College of Optometry. So right here in the heart of Manhattan.
How long have you been there?
So almost 10 years now. So I started there in 2016. So I started here, excuse me, in 2016. So yeah, it's coming up on 10 years, believe it or not. I mean, time goes. Yeah, time really flies.
We can tell by both of
But the
our beards
grays,
are looking
exactly. That's exactly
similar.
it.
Are looking similar.
Yeah.
So this is where you are now. A question that I like to ask all of my guests is: did you always want to be an optometrist? Was optometry the journey for you?
Sure. Yeah. Actually, so the short answer, I mean, no, that was not something that was on my radar, particularly early on when I was younger. So just to give you an idea, so my father is an electrical engineer. He's somebody that when he uh, graduated from engineering, and then he did his professional engineering degree at the University of Toronto in Canada. He worked his thesis on the microprocessor. So again, in 1980, when he did that, we're talking about. I mean, I had computers in my house since like the day I was born, uh, and these computers where a 5 meg hard drive weighed 35 pounds, right? I mean, it was this big and it was made out of metal. Computers was something that I was really fascinated about. I thought that I wanted to do, and obviously I looked up to my father, and I was like, oh, I kind of want to become an engineer. And being an Indian father that he is, he said, no, you're not. He's like, "You're becoming a doctor." I'm like, "No, but I really want to be an engineer." So yeah, so early in life, that was something that those were my goals. However, as I moved on, as I got to high school, and my father was really the person that says, you should really think about going into healthcare, going into medicine. And I was trying to figure out a way because finding a way to go into healthcare, but I didn't want to. Do I really want to treat sick patients all day? And I was not thinking surgery or being in a hospital or an ER setting. Um, Me as a person, I needed eyeglasses at a pretty young age. Age 11, I started wearing eyeglasses. I was someone who was nearsighted. The other thing that kind of drew me to eye care as well is the fact that so when it comes to eyeglasses, I mean, there's a lot of optics involved, and the optics really fascinated me. Uh, Even things like contact lenses, thinking of you can literally put a piece of plastic on your eye and
Yeah.
it helps you see. I mean, even to this day, it sounds crazy. And one thing I don't know. Dr. K, I don't know if you know this, but my dad has keratoconus. So my dad was somebody who couldn't see well and, literally put a piece of plastic in his eye
Yeah.
that allowed him to see. So going from not seeing to seeing. And he actually has cornea transplants and he went through a number of cornea transplants in his day. I spent time with him going to optometrist offices and his ophthalmologist offices. And I just remember the fact that the optometrist offices, those ones where they spend a little more time, with my dad. And the other thing was that, it was just this idea of, again, a tiny piece of plastic that you can put into your eye that, you go from not seeing to seeing. So, my initial sort of journey into optometry, what I kind of thought that I wanted to do was, yeah, I want to become an optometrist and I wanted to fit specialty contact lenses. That is very different than what I do now. But that's really how I got into it. So in high school, it was again, I studied the sciences. Physics was actually my favorite class in high school. And then going off to university, so I went to the University of Waterloo in Canada for my undergraduate. Again, physics courses were the ones that I enjoyed, the optics courses particularly. But I started at the University of Waterloo as a pre-optometry student. So I was lucky enough that I went into university thinking that I wanted to become an optometrist. The funny thing is that, optometry school within Canada is very competitive. I don't know what the numbers are now, but the University of Waterloo for optometry, it was like 60 or 64 students. The University of Montreal, which was the other optometry school in Canada, that had 40 students per class. University of Montreal is a French speaking school, and I don't speak any French. So optometry, it was very, very competitive. So it was one of one of these things where for me, ophthalmology would have been my backup choice to optometry.
Really.
So yeah, I liked eyes. I was so intrigued by eyes so much that I didn't get into optometry. I was like, oh, maybe I should go into ophthalmology. I guess that's kind of close. Yeah. Although now when I look at it, um, I mean, I think I probably could have been a pretty good surgeon. So if I went into ophthalmology, um, yeah, because surgery was not on my radar, as I mentioned, when I got into optometry.
Well,
Things have
you're
changed
not
now.
lacking the smarts, dude. It's not like you struggled, right? I don't ever remember you struggling to take a test. It's pretty straightforward. And I think what's happened, particularly with optometry in the US, for example, and the US is, I would probably say a global leader in terms of what optometrists can do because of the way they fight for their rights. But, if you wanted to do surgical stuff in some states, you're almost there, right? If you've got a clean room, and we were talking about it earlier about, some lid procedures and suturing and things like that. And the ophthalmologists are going to hate me for saying it, but optometry is getting closer. We're not there. I'm not going to even try and pretend that, yeah, we're as good as, someone who's gone through 7 years of medical school and then done another 7 years of, specialty training. But there are elements within that ophthalmology and optometry field that definitely overlap. And that is starting to kind of teeter on some of the surgical elements as well. So that doesn't surprise me, mate. If you'd put your mind to it, you probably would have smashed that as well.
Well, that's the thing. I mean, funny you should bring that up. And of course, in this podcast, we're not trying to be political, or we're not trying to burn any bridges, or my relationships with ophthalmology has always been very close. And so I've been very lucky to work with some really great ophthalmologists, and I'll talk about that here in a minute. However, you're absolutely right. I mean, when I started optometry school, so I started optometry school in 2003 and graduated in '07. So when I started optometry school, I went to the Michigan College of Optometry, and Michigan at the time very recently passed their orals laws, so where optometrists can prescribe orals. I think it was the late '90s when that happened. And so their therapeutics was something that, I mean, you can pretty much prescribe anything you wanted for the most part for the eye, including narcotics. So you had a DA number where you can prescribe things like oxycodone and certain types of, I guess, depending on where you are, hydrocodone, really depends on again, where and they do vary per state. And I don't know exactly, I don't remember now exactly where Michigan was on which type of class of medications that optometrists could prescribe. But going into optometry in the US, one of the big things was that from day one, it was like, we are part of the medical profession. So the medical aspect was obviously something that was emphasized. Our pharmacology classes were taught by, so I was on a campus and the pharmacology classes were taught by pharmacists. The faculty would walk over and teach us. And then, we learned even back then, how to suture, how to start IVs,
Okay.
and we went to the nursing college. So we walked over to the nursing college, and the nurses, taught the optometry students. So every single optometry student learned how to do basic suturing, learned how to start IVs and do intramuscular injections and sub-Q injections, and things like that was something that it was there from day one, at least in part of my education, which was very surprising to me because it was very different as compared to how optometry was practiced in Canada. And that's, of course, one of the reasons why I stayed in the US was the fact that, this is what the scope of practice is. And then you're 100% right. I mean, we have here in the US, I think there's about 22 states or so which allow optometrists to remove skin tags, lumps, bumps, inject, into the lids. A handful of states allow optometrists to do like paracentesis, so Durista. I think 5 states allow optometrists to do that. We have 14 states that allow optometrists to do in-office laser procedures. When I say lasers, I'm talking about YAG, SLT, and LPI procedures. We have states that allow optometrists to do corneal cross-linking, so a lot of states allow that, as well. So this whole idea of some of the surgical care, optometrists have been trained to do this for quite some time. You're absolutely right because as part of my career, I spent almost 4 years at Johns Hopkins and working side by side with medical residents, so ophthalmology residents and ophthalmology fellows. And you're right, the training is different. Doing intraocular surgery, it's very different. And I'm not saying anything about their training. Their training is really tough. It's tougher training as compared to the training that we've got as optometrists. However, there are certain procedures, and a great example of it is, so I teach the ophthalmic lasers and in-office surgical procedures course here at SUNY, and when it comes to a YAG laser, an SLT, or a YAG LPI, as you know this, I mean, it literally is a slit lamp. The technical components of actually performing the procedure, optometrists have that skill set. They can work the slit lamp, focus on where they need to focus. The only additional thing is now that they're learning things like what settings that they need to put it onto, but everything else, optometrists know. When I say everything else, I really mean that. Everything else. I mean, when it comes to diagnosis of whether it be glaucoma, where you're trying to an open angle glaucoma where you're going to be doing an SLT, or whether it be diagnosing somebody with an anatomical narrow angle, that's something that optometrists know how to do. When you apply the laser energy and the patient has a uveitis, they have a little bit of iritis following the procedure. Well, you know how to treat that. You do an LPI and there's a little bit of blood in the AC. Well, guess what? You know how to treat that. These are things that optometrists know how to treat. We've been co-managing these cases for a very long time. So yeah, if a patient does develop a little bit of CME post YAG, well, yeah, you know what? Let's start them on an NSAID. Let's watch this patient closely. Let's put them on the steroid and for a little bit longer. So even managing a lot of the complications, optometrists know how to handle that. And if by chance, and I guess I've never seen this yet, but if by chance that there was a severe, yeah, exactly, knock on wood, that's exactly it. If there was a severe, complication, well, we know how to call and get on the phone and call somebody, right? But I mean, if you think about it, I mean, if a anterior segment cataract cornea doc, right, ophthalmologist, if they're performing a YAG capsulotomy, and they blasted that vitreous a little too much, and we find that this patient has a retinal tear, right? What is that ophthalmologist going to do? They're going to call their retina buddy. They're going to be like, "Hey, buddy, this is what happened. Can you help me out here? Can you deal with this?" Or again, a patient who's a high myope who might have a retinal detachment. an anterior segment cornea doc will do exactly the same thing we do, which is, hey, let me go ahead and call my retina guy, and he'll help me out in this situation. And, again, optometry is no different. I have a whole bunch of retina guys on my speed dial on my phone. I have a whole bunch of cornea guys, and I have a whole bunch of glaucoma guys on my speed dial. So those types of things, like I said, complications overall are pretty. A few years ago, there was a paper by Nate Lighthizer where he looked at data, and we're talking like 50,000 cases of lasers performed by optometrists, and the complication rates are on par with ophthalmology. I mean, it's sort of the same type of thing. Well, that being said, when it comes to risk, you don't see that here in the U.S. Again, being involved with training of optometry students in laser procedures or the basics of suturing, as I mentioned before, I mean, I was at Hopkins for 4 years, and prior to that, when you and I met each other, I was doing my residency at the Ophthalmic Consultants of Boston, where had ophthalmology. We had medical students from Harvard, and we have ophthalmology residents and fellows from Harvard and Tufts. So I got to watch some of their education, and every single one of them at some point is going to have to do their first laser. Every single one of them at some point is going to have their first, again, procedure, whether it be an injection or you name it. Um, you know, their hands are just like our hands, they're shaking just like, the first time we do a procedure and our hands are shaking a little bit,
Yeah.
right? So yeah, it is one of these things where I feel like there's absolutely a need. There is just not enough ophthalmologists to really take care of the patients that are out there. And in order for the patients to get taken care of as they need, and the demand to be filled, optometrists really need to pick up some of the slack. And I say this to my students as well. So because I teach the course, I tell my students this is that only a small number of you, because I have a class of 100 per class, so only a small number of you might decide to really take this to the next level. And we have a separate NBEO boards for laser and surgical procedures. Those students might also want to do a residency in those states that allow optometrists to do those procedures and eventually move on and do them. Like I said, it's probably going to be a small number because there's a big chunk of students that say, I went into optometry because I didn't want to do that stuff. I wanted to do a pediatrics or low vision or contact lenses. And I'm like, yes, I mean, thank you. I mean, somebody needs to do that. Somebody needs to do good refractions and fit contact lenses and do low vision. I applaud my students who go on and do that because that is also, a very big need. I found myself in the off disease realm, and for me, the way that I kind of got into off disease, so, you know, being a student at the Michigan College of Optometry, I can tell you, I did really well in my contact lens courses, not as good in my ocular disease courses. But when I rotated through the Detroit Veterans Hospital, I mean, seeing blood in the eye for the first time, and seeing patients with really severe, whether it be retinopathy or systemic disease, which has ocular complications. I mean, it was like, wow, that is super cool. And
Not for the
I want to,
patient.
not for the patient, that's right. But for me as a learner, I was like, oh my God, these things that I've only heard about in the classroom, I'm getting to see. Being part of a team. So at the Detroit Veterans Hospital, again, we have optometry and ophthalmology are side by side. So we're on it's the same hall. Ophthalmology rooms are this way, optometry rooms are this way, and we can just talk to each other in the middle of the hallway. And the chief of optometry, chief of ophthalmology share an office. So when I would go to present my cases, really presenting to both of them. And yeah, I mean, it was one of these scenarios where, I felt like I was lacking a little bit in my disease knowledge. So being me, I'm like, oh, I want to do a disease residency so I can be better at that. I wanted to challenge myself. And that's what
So
I did. And I
you've
just really got into it.
yeah, you answered my question. I was going to go. You started off saying contact lenses,
Yeah.
and when
Yeah.
we met, you were the OCB
Right.
resident, which is ophthalmology, and one of the toughest residencies to get into. Very hard sought after residency. So I was like, that, that's a big jump. I'm almost the inverse of that, right? So when I came to the States, I was like, yeah, I'm all about disease. And I totally agree with you. Those optometrists who want to deal with pediatrics, good for you. Because I don't really, that's not really my bag. And it's not something that I'm particularly interested in. So if you want to do that and you're great at it, that is awesome. I think what is good in the US is the fact that you can specialize. So you get optometrists who will have one lane and they will stay in that lane and they will make a good living, have a successful and happy career with their main
Yeah.
interest being, some niche aspect of pediatric optometry.
Mhm.
In the UK, we don't quite get that yet. We do have practitioners who kind of specialize, but a lot of our new grads come out, I think, thinking that their only real career path is to be a generalist. You don't, they're not coming out going, right, I want to be niche contact lens specialist. And they don't get that unless they've come across people who do it and they've spent time with them and they've gone, oh, actually, this is really interesting. Because the problem that we have in the UK, and to a certain extent to the US as well, is when you're fitting those contact lens patients in clinic, it's normally your colleagues, right? So unless someone has a KC, you
Mhm.
don't really see it. And then no one really wants to wear an RGP anymore. So all of those ground level skills get a bit lost.
Mhm.
And then you go into the real world and you're kind of like, you want to pay your school, student debt off and you get stuck into something and you don't really step away from it. But there are, there's not as much of it here as there is in the US,
Yeah.
but it's interesting. It's interesting how the different countries do that,
Yeah. Yeah.
considering the education's almost exactly the same. There's not much difference in the education.
Yeah, I mean, I was about to ask you because I mean, you have the opportunity, of course, of studying in the UK first, working a little bit, and then joining, school at NECO. And how did you feel like, yeah, in terms of the difference in education?
The only difference was the oct disease
Yeah.
and the stuff that comes with the oct disease. So like
Hmm.
the farm was more in depth, the oct
Yeah.
disease was more in depth, neuro, but like the peds was the same. The VT was the same. Like all the optics is the same. It doesn't change from
Yeah.
continent to continent.
Yep.
So
Yeah.
all
Very
of
true.
that stuff was just the same. The only thing that the real difference was the oct disease side of stuff, which I suspect is probably the same as Canada, where they may not have dipped into it as much as our US colleagues did, just because they're offering more, right?
Yeah. No. Yeah. Nope. Nope. You're absolutely 100% right. And the interesting thing there, because you kind of mentioned this, as well, is that um, there is something to be said about being a generalist as well. I think that there is actually true value in that, and I feel like we are losing that a little bit here in the U.S. Because again, I do remember, as a resident, I taught a lab at NECO. It was actually a contact lens lab at NECO. It's a
Didn't
Thursday
we all?
afternoon. Yeah, so,
We all
again,
had to.
exactly, we did, right. So, I taught a lab and exactly, you did the same. And, I do remember chatting with, one of the contact lens faculty that eventually she left NECO and joined the Mass Eye and Ear in Boston there. And I remember chatting with her, and she's like, "Oh yeah, like I am now part of the cornea division at the Mass Eye and Ear, and I'm just fitting irregular cornea, so post transplant corneas, post you know patients who have severe ocular trauma, let's say, and they're perforating injury that they got sewed up, and now they have to put a contact lens on top of that. So, she herself was like, this is great. I'm very challenged. I'm fitting these crazy contact lenses. And she's like, I'm happy as a clam because I've, haven't looked at a retina for the past, year and a half. And, she can go through her career actually not even looking at a retina again. So, yes, I think it's exciting. We get to do super fun things. When I join the faculty at Johns Hopkins. So just as a little background, so following my residency at the Ophthalmic Consultants of Boston, I ended up joining the faculty at the Ohio State at the College of Optometry there. And I spent 4 years there, and eventually I was the chief of the ocular disease service there, and ocular disease is sort of what I did. I enjoyed my time there for sure. I'm grateful for the research opportunities that I had, and really to hone in on my teaching chops and organizations of labs and classes, and I started lecturing a lot more.
So I'm
Uh,
curious about that,
yeah,
Anu. Sorry to cut you off,
sure.
mate.
Yeah, yeah, go for it.
So with the Ohio job, was that something like they were advertising and you went for it? Or was it like, you know how it is, the more you're within the industry, the more you get to meet people? Or did someone kind of reach out to you and go, you know what, dude, you're good. We have a role. Would this be something you're interested in? Or was it something you just went, you know what? I don't mind being in Ohio.
So yeah, so kind of funny you should say that. So going back to how I ended up in this career and ended up in academia, as you and I were chatting about earlier, is that I went into school thinking that I was going to graduate and I'm going to, work in a private practice. I'm going to fit contact lenses and take care of people like my dad and do primary care optometry. That was sort of the vibe. However, towards the end of my optometry school career, I really thought about, teaching could be interesting. It might be something that I would want to do. And I remember talking to the dean at the Michigan College of Optometry, and at the time it was Kevin Alexander, who was the president of the AOA, I think a year or so before. I remember talking to him about, how do I get into academia, and he was sort of, talking to me about, yeah, you get in by doing a residency and at an academic institution, and then joining the clinical faculty, or you can go ahead and get an advanced degree. So, doing a master's, a PhD, or doing academia that way. So it was in the back of my mind where I was thinking that, what, like I kind of like this idea of academics, and I might want to do it for a few years and just kind of see where it takes me. So during my residency, that's when I started applying to some optometry schools, and I applied to a handful, and I interviewed at a handful, and I remember I was at an academy meeting as a resident, and I ran into a friend of mine who graduated 2 years ahead of me, at the Michigan College of Optometry, and, as I went up to her and just catching up. I haven't seen her in a little while, and I was like, "Yeah, I'm looking to, get into academia, and I see that you're a faculty at Ohio State. Like, do you have any advice for me? How would I do that?" And she's like, "Follow me." So she literally walked me over and introduced me to the associate dean, and here's the associate dean. Get your contact info, connect, make this happen. So yeah, so I met with the associate dean, Carla Zanuck, who eventually became dean at Ohio State, and yeah, we had a great discussion, and I eventually interviewed and reached out to her, and sure enough, that's how I started my career at Ohio State, and yeah, it was absolutely fantastic. It was really one of the best things that can happen. So I actually got very lucky, as you can imagine. It was just via conversation, and I tell my students this: there is an importance of going to the meetings and shaking some hands and chatting with people. That is very important.
We don't have the same kind of conference culture the US optometrists have. So we have some conferences and people go, but they usually just go get their CPD, CET points, and then
Mhm,
they're kind
mhm.
of, how many free pens can I get? And, they move on, right?
Yeah.
But there is so much. So, I mean, the role I have now is because I met my business partner at an academy meeting.
Mhm.
I was talking to someone and he came over to talk to that person. And I looked at his name badge and went, "Oh, I'm moving there once I get married."
Yeah.
And he's like, "Well, once you move to Northampton, come and see my practice." Went and saw the practice, didn't hear from him for 2 years. And
Yeah.
then he was like, "Oh, we're looking to take someone on." And he thought of me. And then, the rest is history, as it were.
Yeah. Well, that story is almost exactly how, again, one of my good friends, my roommate during undergrad. So he's an optometrist, and he was doing a residency at Berkeley, and the academy happened to be there, or at least in California that year.
Is
And because
Anaheim? Was it the Anaheim one?
maybe I don't exactly. I can't remember which academy it was, but he ended up just chatting with these two dudes that were just there, and it was this same situation where you're like, "Oh, you're from Toronto?" He's like, "Yeah, yeah, I'm from Toronto, and I'm hoping to go back and once I finish my residency." And they're like, "Oh, we're looking to bring somebody on. Why don't you swing by?" And you know, it, and then he's been in that practice, so he's an owner. He owns that practice now. But yeah, for the past 20 years, he's a practice owner because of that. So yeah, it's super, super important. I think it's awesome to that we luckily we have that. And I tell my students, yeah, you got to get out there, you got to mingle, even if it's the local association meetings or, one of the advice I gave to some of my students, if you're planning on moving to a certain state, each state has their own optometric association, which holds their own meetings. Let's just fly down there for a weekend and, shake a few hands. I mean, we'll just go and like see what the conference is like and then shake a few hands and say, "Yeah, I'm going to be graduating soon, or I'm going to be moving to this area soon." And yeah, you kind of never know where those connections,
So I mean, so we're narrowing it down. We're narrowing it down. We've bumped contact lenses because contact lenses is easy, isn't it? It's just all empirical fitting now. There's no real thought involved in that. You've then got OC disease and
yeah.
you're at Ohio. When did you really get into, and you've mentioned Johns Hopkins, which was your next stop, I believe, after Ohio. When did you really get into the glaucoma? Because that's really your baby now, right?
Oh, 100%. Yeah. Yeah. So
That's
some
what
of
it is.
it, yeah, some of it was, during residency. I mean, I've always sort of had that, I thought it was a sort of a fascinating disease. So during residency, as you mentioned, the Ophthalmic Consultants of Boston. So my major, I guess, pretending mentors there were one, Brad Chingleton. He's a glaucoma surgeon. So he's a glaucoma cataract surgeon. And I spent most of my time working with him. So the way the schedule worked out was that I would work with him on Tuesdays and Wednesdays. So Monday was sort of a primary care day, but I'll also see a lot of his post ops on Mondays. So that was a post op day. Tuesday and Wednesday were clinic days, so I would see patients with him in the clinic. So that was again an amazing learning experience. Thursday morning was sort of a primary care day, and I spent Thursday afternoon at NECO teaching. And then Friday was our research day. So I researched with Brad Shingleton. It was one of these scenarios where Brad was one, and Mark O'Donoghue, who you may know is as well, and he took over as director of the clinic at NECO from OCB. I got to spend a whole day a week with them doing research, and we had two publications that were published in the Journal of Cataract and Refractive Surgery, which was, again, it kind of sparked it furthered, I guess, my interest in glaucoma, but B, also got me into research a little bit as well, where I got to be part of two major publications. So, it was always on the back of my mind. And then really when um, really when I kind of took over in the glaucoma space was, after spending 4 years at Ohio State, I really missed the ophthalmology aspect of it, where, again, seeing the 1 day post-ops, the tubes, the trabs, and at the time there was, again, a lot of these really cool early, almost like precursor to the MIGS and the MIBS procedures that are out there now. So, for example, Brad Shingleton, and again, we're talking 2007, 2008, started doing ab externo cannuloplasties. So that was one of the procedures that he started doing. So it really got my interest in these types of procedures. I was just looking for, surgical co-managing opportunities within an academic center, and that's what brought me to Johns Hopkins. So Johns Hopkins, I saw an ad actually in one of these ophthalmological journals, and Johns Hopkins was looking to open up a clinical location in the DC area, and yeah, I kind of put my name in the ring there and interviewed. Yeah, speaking of sort of you know, specialty, I literally told him at my interview, if you're looking for somebody to, you know, do refractions and contact lenses, like, I'm not your guy. Like, I'll shake your hand right here and I'll just head on out. And they're like, no, 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 like, we need people to really take care of our disease patients. Within that practice, at the time, they had a couple of cornea docs. They had a cornea, ophthalmologist. They had a pediatric ophthalmologist. They had a neuro-ophthalmologist. They had one retina ophthalmologist. Yeah, I'd say two cataract docs, and they didn't have a glaucoma doc. And I'm like, well, glaucoma is kind of what I do. So I ended up co-managing a lot of the glaucoma cases within Baltimore is about maybe 40 miles away from the DC area. So we would have patients that were, sort of in the suburbs of DC, Baltimore, that I co-managed with some of our surgeons up in Baltimore. And that's really when I dove into glaucoma, where I really just saw glaucoma patients for the most part, as well as any sort of emergency patients that would walk in. So we had an optometrist, one of my other colleagues, who she was a cornea contact lens person, where she would fit contact lenses, and she also did most of the primary care exams. And then I did the glaucoma and really the disease patients that would come in. So yeah, spending almost 4 years there. I was at Hopkins, maybe just shy of 4 years. It was all glaucoma, and the more I did it, the more I loved it. The way I talk to my students about glaucoma is that it is one of the diseases that optometrists can treat. And every single day, my goal is preventing blindness. My goal is to slow the disease down so that patients don't go blind in my lifetime. So it is like one of the things that I talk to the students about is that, so you are in this clinic, in my glaucoma clinic. So I have a glaucoma clinic here at SUNY. We're preventing blindness, and optometrists play a really, really big role, and probably one of the most important roles, because we're the ones that usually pick up on the fact that the patient may have glaucoma. And then B, the initial treatment is usually topical eye drops, um, and now lasers, but mostly topical eye drops. And so optometrists are really on the front lines of glaucoma care and management. So that's what really, really got me into it.
And then how did you end up at SUNY?
Yeah. So yeah, it was one of these scenarios where I remember interviewing at SUNY before I went to Hopkins, and I met a few people at SUNY, and people that you would see. So it was, one of those things where I would see these people at the academy meeting, and we're always chit chat, and I would see some of these folks at the OGS, so the Optometric Glaucoma Society meeting. So so I knew a few of the faculty at SUNY. And every so often, they would reach out and they would be like, "Hey, we have an opening. You should come to SUNY, come to New York. When you get bored of DC, come to New York." After 3 years at Hopkins, so Hopkins, we have 3-year contracts. After 3 years at Hopkins, I signed a terminal contract, so a 1-year contract, and decided to come up to New York. My sister at the time was living here in New York, which was great. It was one of these scenarios where, um, the first time me and my sister lived in the same city since like we were in high school. You know what I mean? Like, it's crazy to think that, but yeah, that's exactly it. So that was awesome. And the other thing is, I always knew that I was going to come back to an optometry school eventually. I knew that I wasn't going to be at Hopkins forever. And the reason being is the fact that, at Hopkins, I was faculty of medicine, at Hopkins. And you can only go so far as an optometrist in a school of medicine. There's no way that I'm going to be dean of medicine without an MD degree, right? So, if I wanted to further my career in academia, then obviously I would have to, come back to an optometry school, and that's exactly what I did, and that's one of the reasons that I came to SUNY. And it was funny because I remember, so Carla Zanuck, the dean, she recently just stepped down as dean at Ohio State. She mentioned before I left, and she's such a sweet person. I owe her a lot, in terms of my career. But, she literally, when I told her that, I'm leaving Ohio State, I'm going to head to Johns Hopkins, and, these are the reasons why. And, she mentioned that, she essentially in California was I think she was at the University of Berkeley maybe, and she was working in ophthalmology. And, she just says, it's one of those things where no matter how good you are, you're always the optometrist in, the ophthalmology setting, you know. And one of the reasons that she decided to pursue her PhD was the fact that she really wanted to be the best at something and really wanted to excel at something. So she's like, you're always going to be the optometrist in the ophthalmology setting. And I kind of took that to heart. Like I realized, I really enjoyed my time there, but I knew what I was doing there. What I was doing there was at Hopkins, I was trying to get as much clinical experience as possible, trying to really like surround myself with the smartest people possible. I always said this. One of the big reasons I went to Hopkins is that I literally wanted to be the dumbest person in the room. I just wanted to absorb as much knowledge as I can. So that was my goal. I want to be the dumbest person in the room because I want to learn as much as I can, and that's what I took from there.
I saw something. I can't remember. It was some kind of Instagrammy thing, like you do in middle of the night, doom scrolling. It was a quote. I can't remember who it was by, so I apologize to whoever I've stolen this from. But basically, it was like, if you're the smartest person in the room, you're in the wrong room.
Yeah, yeah,
And I'm like, yeah, that's about right.
yeah,
You progressing and developing if you have no one to kind of drive you, and
sure, yeah,
that aspirational stuff, someone to aim towards.
hmm
And you've just said it, that you wanted to be, you
yeah,
know,
yeah,
the dumbest person in the room, which dude, I know you, and I'm not blowing smoke, right? I know how smart you are. So for you to have been like, maybe not the dumbest person in the room, but not the smartest person in the room, that must have been a pretty impressive room.
yeah, yeah. I mean, well, that's exactly it. I mean, these are people that are absolute legends, within glaucoma. So, again, I remember this vividly. Some of your UK listeners may not know some of these people, but Harry Quigley is probably one of the best known glaucoma docs in Hopkins. David Friedman is sort of another. He's now chair at Harvard, Mass Eye and Ear. These brilliant, brilliant people that I'm at a conference, and when I say conference, it's like a small little glaucoma group where there's 10 of us there, and I'm literally sitting across from some of the smartest people that I've ever, like, known. I mean, Harry Quigley is the most referenced glaucoma published author in the world. I mean, David Friedman was behind the ZAP trial. He's the one that, why we talk about LPIs. Like, I mean, these are big name people that, who not only do I know them, like they know who I am, which is crazy to me. Like, I
Yeah.
still, like, that is insane that they know who I am, right? So it is pretty amazing, to be in those spaces and in those rooms of absolute legends. So yeah, I feel very lucky for being there and doing that. It opened up many doors for me, and then being here in New York again, I get to hang out with some really really smart people that I always feel like I'm always learning, I'm always challenging myself. So yeah, I mean, I really can't ask for anything more. And again, the big reason to go into academia is just that. I mean, it is to really surround yourself with academic minded people, people that sort of push you to get better and better, and also to start publishing, papers. So you have something that you're interested in. Let's work on this together and answer, questions for the next group of eye care providers that are out there. So yeah, it's absolutely awesome.
Fantastic. Dude, and here we are. And I told you we'd crack 30 minutes. I didn't even say anything this time. I was
Right.
like, right, well, let's just keep going. This is
Right.
this is this is
Yeah.
going really well.
Yeah.
I think, there's a lot of stuff within your journey, Anu, that's really fascinating in terms of how, I think particularly in the UK, right? And probably in the US as well, you kind of go into optometry thinking, this is what I'm gonna be. This is what I'm gonna leave as. And then as the journey progresses, you can sidestep and you can go, well, actually, maybe there's another branch that I can take, or something else of interest that is more interesting than what you stepped in with. Within the series of pods that I've done, now I've spoken to people who've, really stepped out from optometry to do some really diverse stuff because they'd learned enough within the degree.
Mhm, mhm.
I think in the US, it's more a case of, when you take an optometry degree, it's already your second degree, right? So you've got all your financial burden of your undergrad. You then go into a postgrad thing. So most US optometry students, what we would in England, they would be mature students because we're going in at 19, 18, 19, 20. Whereas the US guys are going at 23, 24. So you're sort of making those life decisions about what you want to do. But I think it's really important for everyone to know just because you have gone down, having the optometry degree doesn't restrict you to being an optometrist
Yeah.
in whatever generalization you want to put that. There are so many opportunities within it to sidestep and make decisions to keep you happy, because for me, just refract and refer was boring.
Mhm.
I,
Yep.
I couldn't do it. I got tired of that. And I wanted to be able to manage my patients. And that's why, when I came to the States, I was like, yeah, this is for me. Now you know me, I do a lot of oc disease for UK,
Yeah.
but I do so much contact lenses, and I get to be the person who, helped you, like people like your dad,
Yeah.
where you put a lens on their eye and they go, shit, I can see,
It's amazing. Yeah. Yeah.
right?
Yeah.
And sometimes I think in the UK, we've got this big shift towards OG disease and disease management. And you're right, you do need those primary care generalists who can, they're changing lives
Right.
on a day-to-day basis, but just in different ways, right?
Yeah.
Getting that 8-year-old to be able to see the board, life
Yep.
changed. All of these different things. And it's just nice, I think. When I started the pod, I don't think I ever told you this. When I started the pod, I was so kind of disgruntled, and I was like, I'm just going to talk to people who've stopped doing optometry because they hated it and they didn't want to be stuck in a room with no windows. And I realized I wasn't hanging out with those kind of people. The people I'm hanging out with were the best of the best, like yourself, who are inspiring and inspired by the profession and want to keep doing it. And some of them took different routes. A couple of head guys at senior contact lens companies, because that's the route they wanted to take. But it was never
Mhm.
because they didn't like, there wasn't, what did I call it? I referred to this to someone. I said, there wasn't like a canon event that made them go, you know, done with optometry kind of thing. It was just a natural progression.
Yeah.
But I'm going to stop talking because it's actually more of your journey than my opinions of it. And we are about to crack an hour, and I know you actually do have to work. I've got to go to bed, so it's all right for me. One piece of advice, dude.
Yeah.
What do you like? What's that? Those students come in and you go, right, the one piece of advice you always give them or you would
Yeah.
always recommend to someone.
Yeah. Well, again, that's a super tough question just because of the fact that I don't think that there is one piece of advice that you can give anybody. There's certain pieces of advice that I do give the students is that, for one, I mean, definitely have an open mind, and branch out, because you never know what you're going to like. As I mentioned before, I was really into contact lenses. I was really into the optics, and that's how I started. But again, during my clinical rotations, things change, and this you can lead you to a passion that you never knew you had. So, and I see this again as an educator. I mean, I've been educating now, as you said, for almost 20 years, right? So when it comes to every class, what I sometimes find is students are like, why do I have to take this? Like, I don't think I'm gonna like do this, or I actually I want to go into pediatrics. Like, I don't know why I'm here in low vision glass or whatever it may be. It's like, approach it with an open mind, because you never know again where you would find your passion, and your passion can be anywhere. The other thing is that branch out as much as possible. And, we kind of alluded to this already in terms of when a conference is. But as part of your education, when you go off on clinical rotations, so we're here in New York, and NYC is like, I'm not saying the best city in the world, but it's an amazing city, and students love being here and want to stay here. But you know what? Like, branch out. Go on your clinical rotations somewhere else. It will give you a completely different perspective. Do a residency somewhere else. One of the best advice that I had, I was at the Detroit VA as part of one of my clinical rotations, and the attending there was like, he really, as I was asking about residencies, and he was just like, are you married? And I was like, no. Do you have any kids? At times like, no. So he's like, just go somewhere. Residencies a year, just go somewhere, and that's how I ended up in Boston. So branching out, I think, of course, is super super important. And then the other thing is that I leave students with is that like you kind of said it. People think about optometry and spinning the dials in the dark room. And I remember when we were renovating our clinic when I was at Hopkins, where we had these beautiful windows, and then they started boarding them up and then painting it over. And I was like, what profession did I choose where we're literally boarding up windows, right? But and that could be very
That was
depressing.
because you're in DC, dude. That had
Yeah,
nothing to
yeah,
do
yeah,
with
yeah,
that. Nothing.
exactly. Right, exactly. um, but there was like just like you mentioned it, there was so much in optometry that you can do. I've had students who went on and joined sales teams at Bausch& and Lomb and Cooper Vision and such. I've had students who are now these like medical surgical liaisons, these big companies, Alcon and Bausch& and Lomb, they hire optometrists to be these sales folks or medical liaisons. We have optometrists who run research programs at some of these large companies, or even here at SUNY, is that we've hired a whole bunch of optometrists in our research center doing research. Because some of the research that I did when I was at Ohio State and started getting into research, it was like the research that I was doing. I'm not playing with test tubes or anything like that. It was literally I was seeing a patient, and since I was working with Kelly Nichols, and she does a lot of dry eye things, so she was at Ohio State at the time, and her research was on eye dryness. So I got to do a study with her where we looked at staining patterns and survey scores and tear breakup times and Schirmer's tests on postmenopausal women, and we're comparing it to a premenopausal population, or these patients on this hormone versus that, because we drew blood and other things like that. So like, I mean, I was literally just doing optometry. I was grading staining on a cornea. So as an optometrist, you can get into that. I mean, you can absolutely do that. We're always looking for people to do that. Some optometrists really get into the business aspect of optometry, and they start, one of my roommates during optometry school, he ended up buying a whole bunch of leases at Costco, and now he just sits back and he hires associate optometrist and per locum optometrist, and he's a business owner, and he doesn't touch the dials anymore. Academia, you can teach, right? I mean, there are so many things that you can do as an optometrist that I think it's almost limitless. I was recently talking to some of the folks at our state associations, and they're on these healthcare committees. Like they are ones that are shaping policy. So their days are spent in the political aspect, but they're shaping policies because I mean, you mentioned 8-year-old who can't see. Well, in Chicago, one of the policies that they did for Illinois was to mandate a eye exam for for students, for kids, and ensuring that kids get eyeglasses. That's a policy thing where optometrists need to be sitting on those committees to ensure that that's what happens, because we know that visual learning is important. So, yeah, I mean, optometry is really, unlimited. There's a lot of times where, yes, it could be you might feel boxed in, but sometimes just taking a step out, just like you did, and many other folks on this podcast did, that really opened up doors for them and open up their career for them completely different than what they expected it to be. So yeah.
Thanks for that, dude. That was a lovely way to end.
Appreciate
And
that.
I want to thank you again. Thank you for taking time. I'd like to thank your IT guy. Also, I'll give him a
Yes.
shout out
Thank you. Yes, exactly.
for getting you up and running.
That's
And
exactly it.
hopefully we will catch up soon. I'm not sure when I'm next in the States, and well, not at a conference. I'm probably going to give Anaheim a miss. I've done Anaheim, so I've got to try and find a city that I've not visited. But maybe I'll do something else. Maybe I'll try something else. But lovely seeing you. You have a great day,
Always, man. Yeah.
and
Hey, thanks for having
yeah,
me, and
take
I
care.
I hope we get to connect soon.
Yeah, it'd be great.